I rise today to talk about an issue that is impacting every state in our nation, an issue that has the potential to impact every community, every family, and every person in the chamber today, and that is the drug and substance abuse crisis. My home state of West Virginia knows all too well about the scars that this crisis has created and the devastating toll that it takes. West Virginia ultimately, unfortunately, continues to lead the nation in overdose deaths per capita. That's a sad statistic for us. And although these deaths have been declining, every single overdose death is one too many. In 2020, we lost 1,197 West Virginians to overdoses. Data from our state health department indicates that over 80% of these deaths included an opioid. Our state's EMS teams responded to over 9,000 suspected overdose calls, and there were 6,916 emergency room visits related to overdoses. These numbers are just staggering and clearly show the continued and urgent need to address this crisis and the many forms that it comes in. This is certainly an issue that requires immediate attention from every level of government and deserves more than just 4 mentions in the President's most recent budget proposal. While I feel that the President and his administration lack that sense of urgency, ending the addiction crisis and taking action to serve countless lives remains one of my top priorities. Each time I meet with our northern or our southern U.S. attorneys in West Virginia, the drug crisis is by far the largest topic of discussion. Their offices see firsthand the amount of illicit drugs that are entering our state and work around the clock to remove the threat that these substances create in our communities. Like I've said in this chamber before, last October, our U.S. Attorney's Office of the Northern District of West Virginia recovered approximately 75 pounds of cocaine, 19 pounds of methamphetamine, and nearly 5 pounds of fentanyl in Wheeling, West Virginia on one bust. Investigators found that traffickers had these drugs shipped from the U.S.-Mexican border to Ohio via tractor-trailer and used cash payments to people who flew from California to Pittsburgh to move the cash back and forth. The connection between the crisis at our southern border and the drug epidemic we are seeing at home does not get any clearer than that. In December of last year, the DEA announced nationwide seizures of over 50.6 million fentanyl pills and more than 10,500 pounds of fentanyl powder. The DEA estimates that these seizures could represent 379 potentially fatal overdose, 379 million potential deadly overdoses of fentanyl. Excuse me. That is enough fentanyl to kill every single American, and these are just the drugs that they found. With the Border Patrol stretched unfathomably thin, there is no telling the amount of drugs that are getting through undetected. We know that these drugs are entering our country through the southern border, making their way into each and every state and wreaking havoc. If President Biden would get a little more serious about stopping this, I think he has to get serious about border security. In a crisis this urgent, it is time to act. I've spoken with the DEA administrator about the support they need and the challenges that they're facing. I've introduced legislation, led letters, and pushed for initiatives that inform the public of the dangers of fentanyl getting in the hands of our youth, that strengthen our investigations for fentanyl trafficking, and that prevent fentanyl and synthetic drug shipments from being smuggled into the United States through the mail. Currently, we're working on efforts to crack down and schedule the illicit drug xylazine, which I understand is also known as tranq. If you didn't know by now, xylazine is an easily accessible veterinarian tranquilizer that is being mixed with opioids, including fentanyl, increasing the number of fatal overdoses nationwide. This crisis is ever-changing, which means our approach needs to be multifaceted as well. I encourage the President, his administration, and all of our colleagues right here in the Congress to stay on this effort and stop the latest modifications before it is too late. Even in the midst of devastating losses, in our state. I have always been inspired, encouraged, and moved by the efforts of people in West Virginia to end the drug crisis and help those in our state during the times when they need it the most. West Virginians continue to be responsible for the most innovative recovery solutions and prevention efforts that we have seen. The opioid crisis has made a personal, targeted impact on communities all across our state. And in turn, we've seen success through these community-based solutions. I've seen in Martinsburg, West Virginia, with a program that is a police, school, community, health, and education partnership working to prevent substance use disorders from ever happening to our youth. By building strong families and empowering the community, we build resiliency in children and families to help them overcome this horrible addiction. I've seen this in Carneysville, West Virginia, where they're building a recovery village so that individuals who are struggling with addiction receive access to family and community they definitely need. The detail focus is on housing and workforce development, aspects of recovery that are absolutely critical. I've seen drug court programs all across our state where West Virginians are building each other up, holding each other accountable, and giving those who struggle with addiction the chance for a life of recovery. You know, West Virginians take care of West Virginians, and there is no other issue that requires each and every one of us to work together quite like this one. So, President Biden, the drug crisis has created a dire situation in communities, not just across my state, but across the country. We've no time to waste. And every day of inaction results in turmoil and devastations for so many families and loved ones. We need to secure the southern border. We need to crack down on illicit drug trafficking and new tactics that criminals are implementing. And we need to deliver the tools our communities need to implement federal programs and develop those community-based solutions that we know work best. We must do this together. We must do it now. Countless lives depend on us. And with that, I yield the floor to my colleague from Arkansas, my fellow recycler, Senator Bozeman. Thank you.